We know that inequitable access to education, employment, income, and housing increases the risk for Alzheimer's disease and related dementias, said James Bateman, assistant professor of neurology at Wake Forest University School of Medicine and principal investigator of the study. However, more research is needed to better understand the impact of social determinants of health, including what the study analyzed with neighborhood disadvantage. Bateman said neighborhood disadvantage refers to the lack of social and economic resources in one's environment. To assess neighborhood disadvantage, the research team used the highly recognized National Area Deprivation Index, which measures housing quality, education, and income. Our goal of the study was to analyze the relationship of neighborhood disadvantage with measures of cardiometabolic health and cognition in individuals with and without diagnosed mild cognitive impairment, said Bateman, who is also a neurologist. Bateman said it was important for the team to compare individuals with a diagnosis to those without one to better understand how a person's current cognitive state impacts the relationship between their environment and their health. Cognition refers to the mental process of thinking, learning, and remembering, being aware of surroundings, and using judgment. Mild cognitive impairment is a decline in memory and thinking skills that is greater than expected with normal aging and is a risk factor for dementia. Bateman noted that many cardiometabolic diseases may increase the risk for cognitive impairment and dementia. Cardiometabolic health is the cardiovascular and metabolic health of an individual and involves the management of risk factors such as glucose, blood glucose, high blood pressure, high cholesterol, and obesity. For this study, Bateman and team analyzed data from 537 adults over the age of 55 from the Alzheimer's Disease Research Center Healthy Brain Study at Wake Forest University School of Medicine from 2016 to 2021. Individuals received clinical exams, neurocognitive testing, and neuroimaging, in addition to cardiometabolic tests to screen for diabetes, high cholesterol, and high blood pressure. The neurocognitive testing included in the study evaluated constructs such as memory, executive function, language, concentration, attention, and visuospatial skills. We found an association between neighborhood disadvantage and higher blood pressure and cardiometabolic index, as well as lower cognitive scores in individuals who did not have a diagnosed mild cognitive impairment, said Sudarshan, who is a fifth-year PhD student at Wake Forest University School of Medicine and first author of the paper. Sudarshan said that neighborhood disadvantage was only associated with higher hemoglobin A1C, which measures blood sugar in people with diagnosed mild cognitive impairment. These findings show that living in a disadvantaged neighborhood has a bigger impact on heart health and brain function in people without pre-existing cognitive issues. Bateman said, "Our study highlights the importance of implementing structural changes to address social determinants of health to mitigate cardiometabolic and cognitive risks." And he added that the study underscores the impact of a person's living environment. He also added by saying that this study confirms what we had hypothesized: where you live and the resources and opportunities that are available to you as a result has a tangible impact on your risk of dementia. More details about the study can be found in a research paper of title Impact of Neighborhood Disadvantage on Cardiometabolic Health and Cognition in a Community Dwelling Cohort.